Guys, this is Dr. Mobeen. Hope you had a great Memorial Day weekend. The discussion we are going to resume about the cholelithiasis or gallstones. The topic today is about the pigment stone formation and the main causes of that. And then we'll also talk about the prevalence of the gallstones, not just the pigment stones. So let's start. First of all, we know this from our previous topics that the cholesterol stones are about 80% more prevalent, or 80% of the gallstones are cholesterol stones and about 20% are pigment or mixed stones. The pigment stones formation is a complex process. However, this is known that whenever there is more unconjugated bilirubin present in the biliary tract or bile tree, that is when the pigment stone formation occurs. And now, what is the cause of more unconjugated bilirubin present in the bile tree? The primary causes for pigment stone formation or more unconjugated bilirubin in the biliary tract are two. One is the hemolytic anemia that causes more unconjugated bilirubin to arrive in the liver. And if hepatocytes' capacity to conjugate that bilirubin and then move it into the bile tree is exhausted, if the hepatocytes do not have enough capacity to conjugate it, then that unconjugated bilirubin is going to spill into the bile as well. And now that unconjugated bilirubin is going to predispose patient to start having pigment stones. The other reason is the infections of the liver, the hepatitis. What happens in that case is it is possible that the hepatocytes, their function is reduced, or their number is reduced, or their capability is limited because of the infection, and so they cannot conjugate the bilirubin correctly, and so that unconjugated bilirubin passes into the bile. Or it is also possible that there is enough damage after the infection that there are dead cells which break the boundaries between the blood system and the bile system, and there are unconjugated bilirubin which is spilling into the bile system. All of those reasons would allow the unconjugated bilirubin to be in the bile system, where the pigment stone formation will now become easier. So that is one. Now, in terms of prevalence, it is interesting that the prevalence is age and gender based. Pigment stones, or actually gallstones in general, not just the pigment stones, gallstones are only 5 to 6% prevalent, or the prevalence is only in 5 to 6% of the population for the people with age lesser than 40 years of age. Now, in terms of prevalence is age and gender based. People who are lesser than 40 years of age, the prevalence of gallstones in them is only 5 to 6%. And then people who are greater than 80 years of age, prevalence of gallstones in them is about 25%. So that is one, the age-related prevalence. Then white women are, the gallstones are twice as prevalent in white women than men. So that is the gender-related prevalence. Then if you look at the geography and the other groups, the Native American population can have cholesterol stone, not all gallstones. Cholesterol stone prevalence in them reaches up to 75%. And interestingly, pigment stones are rare in them. And similarly, the Western industrialized nations, they have more prevalence of gallstones compared to developing countries. So this is a little bit about the pigment stones and then the prevalence. We'll continue this discussion, and then we'll talk about the flare-ups and we'll talk about the management later on. Thank you very much.